Doctor, welcome, and thanks for coming on.
Thank you for having me.
So you're a unique case because you originated as an internal medicine doctor
Yes.
in the Soviet Union, and then when you came here, you then became a physical medicine doctor.
Yes, correct.
So tell me about your practice today, and a little bit about yourself.
Well, again, like you said, I specialize in musculoskeletal medicine,
Okay.
physical medicine, rehabilitation, but my experience in the past as internal medicine doctor really helps me a lot to provide better care for my patients.
Okay.
Because, I mean, I'm not treating like right knee or left shoulder. Based on my broader experience in medicine, I'm looking at the bigger picture,
Okay.
and it really helps me to provide better care and probably get better results. I
Oh,
believe
I'm sure.
so.
I mean,
I believe so.
Yeah, not looking at through like that narrow window,
Yes.
you can actually do that.
Yeah, because but our body, it's a whole unit.
Mm-hmm.
So only in medical school we like separate our thoughts and our mind from our physical body, and like Dr. Mate Gabor says, he's a great doctor from Canada. His expression is that we all came just from one cell, fertilized cell. So it's a whole body, it's a unit. And we cannot separate one thing from another. And as doctors, doesn't matter what kind of specialty we are, we just have to try to look at the whole picture, not just the particular very narrow specialty.
So that's what you would consider the holistic approach?
Yes, exactly.
Okay. So your practice today is based around physical medicine. What specifically are you kind of focused on within your practice?
Well, on one hand, I'm conventional trained physical medicine
Okay.
and rehabilitation medical doctor, and of course I provide a lot of mainstream conventional pain management,
Mm-hmm.
different type of injection, trigger points, whatever, different things. But actually my heart belongs to so-called regenerative medicine, which really helps our body to heal itself. And there is time and place for both approaches.
Okay.
And I believe that the best approach would be combination from both sides, and the conventional pain management primarily, not exclusively, but primarily focusing on controlling symptoms, controlling pain. But pain actually, it's a way of our body communicates with our conscious. So when something is injured and broken or compromised, we develop pain. And in the ideal world, we have to try to figure out why we're having pain and trying to help our body to heal the source of the pain. Because our body is like unbelievable, incredible self-healing machine. But sometimes our body needs some support from us to help the healing process to go the right direction and go all the way. Conventional medicine, again, primarily focusing on controlling the pain as a symptom, but symptoms, again, pain, it's a messenger. So and a lot of time we're just killing the messenger instead of trying to like figure out why we're getting this message. And again, if pain is very pronounced, it's not a crime to get the pain under control. Nobody has to suffer. But when we get pain under control, we really have to look into the situation deeper and try to help our body to heal itself. Today, as a society, we're kind of like spoiled with the quick fix mentality.
Definitely the quick fix.
Yeah, quick fix. And a lot of time I hear doc fix me and I have no time for whatever.
But it's not really a fix, right?
It's a very short-term solution, but down the road it gets back to us, and usually in a more pronounced way. So what I really love to do, I love regenerative approach,
Okay.
and based on
So
our
what is,
knowledge.
in the regenerative approach, what What specifically is that? What methods are involved in that?
Well, we have like varieties of methods, and on one hand, they like sounds like new, but all new. It's a well-forgotten old one.
Okay. Like you said, yeah, because our bodies really have always been able to heal themselves.
Yeah, absolutely, absolutely. And like in Russia, we say like despite doctor's effort, patient survived. So because body doing a job, and body it's a great self-healing machine with the excellent program with a lot of backups and with a lot of like huge durability, and we really have to try very hard to screw it up, to compromise it. But again, like time comes when our body needs support from us, and when regenerative medicine can really help. And we're talking about like varieties of methods. Like from my point of view, the fundamental one is prolotherapy. Another name for prolotherapy is non-surgical reconstruction of tendons and ligaments. Why tendons and ligaments? Because especially ligaments and joint capsules and again tendons, they're providing the support for the skeleton, for musculoskeletal system in general.
Yes.
And when joint, for example, has a good, solid, durable joint capsule and ligaments which keep joints together, because joint is just it's two bones. And to make these two bones like functional unit, we need so-called supportive structures, joint capsule, tendons, and ligaments which attach muscle around the joint to the bone, and ligaments which connect bone to bone. And when all the structures are good, solid, and durable, joint will have good support and will move properly. As soon as these structures become like loose, joint loses stability, and we gradually start to injure itself, and we're developing the arthritis most of the time. Another job for these supportive structures are to let our brain know in what position we are in a space. That's why these structures have a lot of nerve ending.
Got it.
And when the structures become compromised, injured, degenerated, overstretched, it will irritate nerve endings, and it will give a lot of pain. So a lot of time, the main pain source, not just the joint itself, like in between the bones, the space between the bones, but the structures around it. And unless we'll address them, which prolotherapy does, we really cannot get good, solid control of the situation.
Okay. That's what you're saying. The pain is the messenger there. It's
Yeah,
just
pain
you,
is the messenger. Don't kill the messenger. Look why you're getting this message.
yeah, look why you're actually in pain and how you can deal with
Absolutely.
that. Yeah. So prolotherapy specifically, so that's what you would use prolotherapy to take care of, but what is it specifically again?
Yes, so again, like I said, another name for prolotherapy is non-surgical reconstruction of tendons and ligaments. Okay. It's a series of injections, and which will stimulate, which will provoke good controlled inflammation, which is the first stage of healing. Without inflammation, further steps of healing will not follow. So again, when we injure ourselves, what we have pain, we have swelling, we might have like the area hot to touch, all of these signs of inflammation. So our body designed to create the inflammation. So it means we need inflammation for some reason. But again, everything's good in moderation. If we have imagine if you have like candle, you have like nice light and like cozy environment, but nothing more than that. When you have fireplace, you have like warm, nice room. But if your house is on fire, it's very dangerous thing. So the same with inflammation. So inflammation should be at the right time, the right place, right intensity, and right duration. So if everything is like properly structured, if you will, so it's a healing mechanism. At the beginning of the healing process, inflammation will activate immune system, and immune system will activate all this like healing process. Again, coming back to conventional approach, but again, inflammation comes with some pain and discomfort, and we're like as a society we're spoiled. We do not want to tolerate any pain, any discomfort. Most of the time we're looking for the quick fix, and we have to run. So we're taking we take pain medication, a lot of them like anti-inflammatory, and we're killing inflammation in the beginning. So we're not letting our body even try to heal itself.
Wow,
And because
I don't think I've ever actually thought about it that way.
Exactly. So again, if we have inflammation, it means we need it. If it's too much inflammation, of course, it has to be like under proper control. But again, we need inflammation to start the healing process. So when we take anti-inflammatory painkillers, we're stopping the self-healing initiation of the body, and we actually transforming the acute injury into the chronic pathology. And because our body has a huge compensatory ability, we can compensate the incompetent zone for other lengthy periods of time. And we might have injury like when we're 20, 15 to whatever, like early years in our life. And we didn't give chance our body to heal properly. And when we're 50 or 60, like all of a sudden, we start to have like, our like knee arthritis, bone on bone, all of a sudden. It didn't happen overnight. So probably something was happening like a while ago, and body was compensating. And most of the time, we start to have symptoms not when the acute. Most of the time, we start to have symptoms not when the problem occurs, unless it's acute injury.
Okay.
We start to having symptoms when body cannot compensate it anymore. And with the coming back with the prolotherapy, we are recreating kind of like acute injury, if you will, with this gentle injections. And we are recreating good controlled inflammation, which is the beginning of the healing, and body will do the rest.
Got it. So you're pretty much with Prolo, if I get that right, you are mimicking what the body might have done when it was
in the beginning of the process. Yes,
okay.
Exactly. So we're recreating good controlled injury, good controlled inflammation, and we kind of reversing we making the process which used to be acute and became chronic for whatever reason, or maybe because of the medication we're taking to suppress the inflammation, or for some reason. Healing process didn't go all the way, or didn't go the right direction. And we kind of like recreating the acute situation. For body, much easier to get the acute situation under control versus chronic. And body will do the rest. And like we said, the prolotherapy from my understanding, from my belief, it's the fundamental like approach. And another thing, the philosophy of prolotherapy, the comprehensive treatment, the entire region, not just the one spot which like bothers the most.
Okay.
A lot of time patient come and say like pinpoint, like, I mean, my knee hurts, but the most painful area like in this spot. Yeah. And of course, important to address this particular spot. But in reality, we have to address the whole region, not just the one spot which hurt the most. And this is a philosophy of prolotherapy, because you have to treat the whole territory, because the spot which hurt the most probably took the bullet, but it happened because the other like areas of this like joint, whatever, didn't do the good job.
They weren't supportive enough.
Yeah, they were not supportive enough, and this particular like spot like suffered the most. So we have to treat the whole region. Like imagine you have like orchestra and all musicians kind of okay, but two of them horrible. So if you will replace those horrible with okay musicians, you still will not get the best music in the world. You have to retrain. You have to like retrain the whole orchestra to work better and
together,
to get the like excellent music. And the same happening with the body. So you have to treat the whole area. And you have to, a lot of time you have to look, you have to be like, a lot of time doctors should be like a detective. We have to try to figure out why this particular area hurt,
Kind of
what
be creative
happened.
with it a little
Yes,
bit, yeah.
absolutely. Yes, what happened? Maybe something happened 20 years ago, 30 years ago, and this area like became the first one to manifest the issue. And unless you will address the area, like maybe a remote area of the body, which was like initial injury, which triggered the pathological changes in other part of the body, which like screaming now, and you really have to like treat all of this to get the good salvage result. But it's possible. Body is extremely appreciative creature, if you will.
Yes.
As soon as we'll like get everything that is necessary, we will get the good outcome.
So I'm sure, it varies over many patients, but do you see a certain timeline of when you actually start to see some results from that type of therapy? Like at least like the start of some results, and then I'm sure it can take maybe months to years. But what would you say like the timeline is on seeing results?
Yeah, of course. Again, the longer negative changes were going on in the like body, the more time body will need to get it under control. But at the same time, these treatments they're very effective in people. Like again, the negative changes were going on gradually, like in the same way positive changes most of the time happening gradually. But in average, most of the time, patient will see difference like in 2-3 weeks after first treatment.
Wow.
Yes,
That's
rather
pretty,
quickly.
Yeah, that's pretty
For
fast.
some patients, when situation is extremely advanced or immune system not at the best,
Okay.
or like nutrition is compromised, not enough like vitamins, like minerals, whatever. Like if something is missing and not at the perfect situation, so sometimes patient might need like second treatment just to see the difference. Extremely rarely third treatment. Again, people different,
Okay.
but I think about like at least 80% of patients will see the difference, positive changes like in 2-3 weeks after first treatment.
Okay. And because it's the regenerative approach, is it something that becomes long lasting, or is it something you have to continuously do?
It depends.
Okay.
If it's a focal injury and pathological changes didn't go like very far, so enough treatment, and usually like we're saying, like again, everybody's different. We cannot just say how many treatments,
Yeah,
but
I
in
understand that.
average, like very rough average, it goes like between 3 treatments to like age divided by 10, kind of like this like
Okay.
interval. We can actually treat area and person might just forget about it. On one hand. Another hand, if for example we have like situation which is like provoking the compromisation of this area. For example, person had like one joint replaced and another, and he or she would like to like avoid the other joint to be replaced. But because of the surgery was done, the gait is kind of a little bit not like perfect, and
Okay.
it's impossible to make like everything. Nobody is perfect, and body is not perfect. And for example, in gait, it's like a little bit some disbalance in gait. Or some patients, for example, have genetic predisposition to have a loose connective tissue, and their ligaments more loose, they're more stretchable but less durable. These type of people, they can be great dancers, so they can do like whatever exotic movement. But there's price for everything. Because they can do that, joints have less support and they're more prone to injury. For those type of people, as soon as we will get like major situation under control, from time to time they might need touch-up treatment, maybe once a year, once in 2 years, every 6 months, depend on the situation. For some patient, it might be like definite like the final solution of the problem, but for some patient they might need from time to time kind of like maintenance, if you will.
Yeah, no, that makes sense.
Yeah.
What other types of regenerative medicine do you do? Because I know, so like we just kind of went over Prolo. What would be another type of regenerative medicine?
So the next
That's
level
pretty
kind
effective,
of,
yeah.
yeah. So again, the like standard classical prolotherapy usually done with a dextrose solution. It's
Okay.
dextrose is sugar. Everybody afraid of the word sugar, but it's a good one. Our body
Yeah.
respond very favorably to it. So, but the same prolotherapy, the same approach can be done with so-called PRP or platelet-rich plasma. So when we get patient blood, spin it in a special centrifuge, separated, concentrated, and we get the so-called the concentration of the platelets. Platelets, it's a small particles in our blood, which have like a lot of growth factors.
Okay.
And when we inject this growth factor in a compromised area, it really like trigger again and again self-regenerative process, but it's more powerful tool. It's more powerful stimulation for the body to begin this self-healing process. And again, a lot of, I mean, like in every field, I believe, in medicine especially, technique plays a huge role. So like this PRP, the platelet-rich plasma can be injected in a couple spots in the most compromised area, like 1, 2, 3 shots, and it's good. A lot of time it's good, but sometimes it's not good enough because if area is broad and not the whole region is addressed, it will give some improvement, but not really solid improvement. So when
injection of PRP is more of a specific.
It's
if you want to target a really specific small area.
more specific spot, but at the same time we can combine the prolotherapy approach of the comprehensive treatment, the whole region, with the PRP.
Okay.
So we still provide the comprehensive treatment, the whole region, but in a syringe instead of dextrose, we have patient's plasma. So not just 1 or 2 shots, but again, the treatment, the whole area, can really make a difference in outcome.
So then you would be treating, if you had a broader area and you wanted to do PRP, then you would just be doing more injections with PRP, or you would be adding also the Prolo.
So it will be, it's a prolotherapy technique.
Okay.
What is in a syringe, that's different. Yes. So it might be dextrose, maybe plasma. And again, plasma, we can use PRP, the platelet-rich plasma, in the most compromised area. And we can use the rest of it to treat the area which is kind of also played the role, but not so manifesting with the symptomatology. So we can get, academic knowledge of the education knowledge of the medicine, it's science. But how you treat your patient, it's art.
That's right.
You really have to be creative. There is no one size fits all or one protocol fits all. Like when we have painters, all of them have 7 colors. But each painter, each artist will create his or her own unique picture. And the same treating the patient, it actually should be art based on scientific knowledge, based on science.
That makes sense. I mean, I think that's where the best doctors come out of, right?
Yeah, we have to. Yeah, we really have to be creative, and again, all the time we have to keep our body, the knowledge of how our body works naturally, to reinforce it and go along with the body instead of suppressing the body and trying to turn it around.
I think that's I think that maybe that's where I see a little bit of the internal medicine side of you kind of coming to
probably
play, right?
Yes, absolutely. I always say we should not treat right knee or left shoulder. We really have to treat the body as a whole. Yeah. And it's impossible to separate it, including psychology and emotional state. And it's everything plays a role. And sometimes when a patient comes and tells me, "Doc, I know nobody can help me. You're my last hope," I know I can do whatever I will do. I can jump as high as I can. It's like almost impossible to. It will be very difficult to help this type of patient because the patient is programmed that nobody, nothing can help.
Okay.
But when I see patient who's saying like, you know what, I tried like everything what I could, what I was able to find, conventional alternative, whatever, it didn't help. But I know that I can find the answer. I'm still looking for the answer. I do not want to give up, and I'm ready to like look outside the box. I know this patient has a very high chance to like get the good outcome from the treatment.
Why is that? Is that just because of the belief you're saying that they're willing to kind of accept the treatment, or is it just more on the psychological side?
Psychological, I mean, belief also plays a huge role, and actually it's like, and I believe it's tango takes two, and you know when patient in doctor, it's good like doctor belief in philosophy, psychology, when it like resonates with patient's belief, philosophy, and psychology. And in this case, I think outcome is much better. And doctors are human being too. We also have like our beliefs and our like the like belief of what's right, what's wrong, what should be done, what should not be done. The same like a patient. And again, belief plays a huge role, and in the right attitude, positive attitude will like program, and our thoughts will actually will help our body to heal, because it will facilitate the different hormones and different like chemistry in the body. In the same way, like negative thoughts and disbelief in a good outcome will facilitate of the production like stress hormones and like the not healing environment in the body. And that's why like psychology also plays like huge role in belief in what you're doing. When I just
what
start,
stress does on the body is, I mean, it's very clear what stress does.
Yeah, absolutely.
That.
And a lot of studies were done about that, like those like patient like the cancer treatment. It's like extremely serious diagnosis, and people respond to this diagnosis very differently. And study was done that those people who are positive and believe in a good a positive outcome and participate and do everything what they have to do and like following their diet, everything, they get a much better outcome versus patients who are depressed, anxious, isolated, getting the same treatment for the same diagnosis for the same stage. They usually getting less, not as good results as a patient who are positive. So the positive outlook and belief in a healing process really helps a lot. You know, when I just started the practice, I mean, when I just start to like implement especially regenerative treatment, in the beginning, when I saw the patient, and kind of I knew that this method should help. There's no guarantee, but we're always talking chances in our life, and that like based on the patient's history and complaints and all like the situation. So I knew that this method should help. And I was like trying to explain patient and convince patient that you have to do it. I mean, it's a good thing to do, and and I saw that some patients accept it very easily and openly, or they just have to think about it and come back. Yes, I thought about it and I love the idea. I will do it. But some patients like really were resisting the idea, but out of respect or inability to say no, they kind of agreed. But I felt that deep inside, they kind of like against it. And for those patients, treatment usually doesn't work as well as for those who believe. And I learned it. Like it took me like some time to like really understand, to bring it to my conscious. And I never do this again. So my duty as a doctor, I establish the diagnosis. I just explain what kind of treatments, conventional, alternative, the positive and negative, the both approaches, and my kind of recommendation, my advice. And after that, I stop.
You don't try to push them any further?
No,
Okay.
no push, because if patient
won't matter anyways.
no, absolutely no.
Okay.
And exactly, I mean, sometimes when patient get excited, I want to have a treatment right away. I said, no. I give you a lot of new information. I want you to go home, like think about it, do your own research. I give some like material to read, but I really encourage patient to read about it.
Okay. Yeah, that's really good. Yeah.
And after
You need that
that,
understanding.
yes, absolutely, and I see the huge difference.
Where do you see the resistance so the people that are resistant to the regenerative medicine, where do you think their resistance is? Why don't they believe in it? Or what stops
Look,
them?
again, we all have our beliefs, and we all have our like belief system in us. And I mean, again, the same like a doctor. Like doctor and patient, always tell the patient, doctor the same human being like you guys, like our patients. So we also have our beliefs. Some doctors believe that only like FDA approved, only conventional medicine have a right to exist. And other doctors say, no, only alternative, nothing conventional. I personally do not like any extremes. I believe that the truth somewhere like in the middle, and we have to,
like everything, right?
Yeah, like in everything, like in every other field, like in our life.
Yeah.
So in my kind of understanding that we have to try to incorporate the best approaches from the both sides. And the same like in patients. So some patients like have a very like firm belief the only FDA approved treatment can be have a right to exist. At least they will they will accept only FDA approved treatments. And other patient, no, all the alternative doesn't matter what, which is the same thing like with the doctors. And if patient has a belief that not only because it's not FDA approved, and despite that we have this like methods available for many years, and a lot of studies done and like observational and scientific, like double-blind and scientific studies, so a lot of data available as of now that it's really like it's a good idea to look into it. But it's because still considered experimental, not like FDA approved.
Okay.
People will like reject it, and they
why
have
that
their
is.
rights.
Yeah.
They have their rights. Look at it's our life. It's choices. Every single day we're making choices, including how we will take care of our physical and body, and how we can treat ourselves. So.
Why do you think that it isn't that it's still considered experimental? Because I think the studies have been going on a pretty long time, right? I mean, this treatment, this isn't new knowledge.
No,
right?
it's new kind of, it's new level, but the idea of all this regenerative is absolutely not new. Like for example, again coming back to prolotherapy, the roots of these methods lying down like in ancient Rome.
Really?
With gladiators here were like injured the fight, and the like injury didn't heal for some period of time. It was like brutal, but the doctors, like whatever, the healers, they like insert the heated rod into the shoulder to like re-injure the area to create the inflammation and start the healing process. These are the roots of the modern prolotherapy. That's amazing.
Yeah.
That's amazing.
So they would just pretty much
re-injuring, recreating the injury, making it acute, and for body much easier to take care of, to heal the acute situation versus chronic, because it's when it's become chronic, not enough blood supply, kind of like immune, like the body kind of like forget about this. It's like in this area becomes silent. Because when it's acutely inflamed, that it screams, body like we pay attention to it, body pays attention to the healing mechanism, pay attention. And when it's like chronic, body kind of like forget and busy with other things which are more pronounced. Okay. And this area like become like forgotten, continue to degenerate.
Wow.
So, and again, coming back to your question, it's difficult to say.
Okay.
It's difficult to say, and we, like as a society, we're probably like focusing more on the technological things, and the chemistry, the medications, which like work very quickly, very fast.
Yeah,
but
it's kind of that
not
quick,
yes,
that quick
exactly.
solution type thing, not
Yeah, but
not a long term.
not yes, because it's the again the regenerative like treatments. It's a process. It's not just quick fix.
No, yeah, that's
Yes, and we have to be consistent. We have to pay attention. We have to do stuff, and we have to be
I guess
patient.
you
And
also
we
have
have
to
to
do. You have to treat your body well too, right? So then you kind of
yes.
have to look at the other aspects of your life. And
Yeah,
say,
yeah, of
well,
course,
right,
of course, of course, of course, of course. It's not the critique. It's just the kind of like explanation, probably why. Not everybody can rearrange their life like around
Yeah.
it, and we have to do what we have to do. We have to run. We have to run. So that's fine. But at the same time, keep in mind but at the same time, a lot of time we can create the situation in to take care of ourselves. Otherwise, we will be forced to like. And again, a friend of mine, he's a chiropractor. He's very good, like very good chiropractor, like
Okay.
with a very broad view
Got
of the
it.
body. And he's saying that if we will not create time to be healthy, we will be forced to create time to be sick. I mean, not to create time. We have to spend time being sick. So on one hand, of course, we're
Right.
running all the time, but at the same time, we have to keep ourselves in mind.
Yes.
So we have to spend time and money or at the beginning of our life, or we will spend time and money like to keeping ourselves healthy,
Yeah.
or we will spend our time and money to being sick.
Yeah. That's just a little sacrifice now.
Yes, so it
that later
depends
on,
what
right?
what.
What led you to regenerative medicine?
Since I was in medical school, I always believe, I firmly believe that whatever health problem nature gives us,
Okay.
the same nature has the answer. We just have to look for it. And probably when I was in medical school, probably it was not so clear in my mind, but intuitively I always felt this way. And again, when I work as internal medicine doctor, part of our kind of routine in health organization system, we had to do house calls as internal medicine doctors. So when I visited my elderly patients, like grandmas and grandpas, so and those generation really use a lot of nature help, especially when they were younger, like herbs and different seeds, whatever. So the patients always a lot of time we're giving them different recipes of different herbs, and different kind of home remedies,
Okay.
which used to work when they were kids, that their parents gave it to them because we didn't have the medications or whatever. And I was collecting this stuff and looking at my family members and I myself the guinea pig for a lot of my new things, and my parents and my sister, they get used to it. They I tried a lot of new things on myself and on my parents and my sister. So I tried all this herbs combinations. So I love it in the very beginning. And again, my belief that our the same the nature which gives us problem, the same nature had the answer. Probably I always was kind of prone to this type of treatments, but I remember what turning point for me was kind of I started to learn about the PRP first before I learned the prolotherapy. And before that, I learned to do the ultrasound diagnostic musculoskeletal ultrasound, and I did a lot of ultrasound guided injections. So, but it helps me to see actually see the body. It's amazing. So kind of, and I attended one of the conferences about PRP and stem cells regenerative treatment in Los Angeles, and I came by myself, and was buffet type of thing, the welcoming kind of party, and all of a sudden, and a man approached to me and without introduction, without hello, without my name is, he asked me, "Do you do prolotherapy?" I heard about prolotherapy by those time, and it was kind of always in the back of my mind that I have to learn it. But I would like to learn so many things, and I have to work. I mean, so it's always was not today, not this year, next year. And when he asked me, "Do you do prolotherapy?" I told him no. And he gave me his card and he told me, "Look, if you really would like to help your patients, you must learn prolotherapy. You have to join our organization. You have to go with us to Honduras."
Wow.
"As a missionary trip, and I will teach you prolotherapy. And it will change your life. As a doctor, it will change the life of your patients." And he just walked away. Just gave me his... that's it, like CIP and disappear.
Wow.
And I look at his cards, and he named the organization. And when I came home, I Googled it, I found it. And so bottom line, a year later, so it was I think it was June. And the following March, I was in Honduras. And this guy, he was there.
A year later, you're saying?
Yes. He was there, and this is how my prolotherapy journey started. And he was so right. It really turned my view upside down.
So it started just on a missionary trip.
Yeah, no. I mean, I took this organization. It's a Hagen Hemmel Prolotherapy Foundation. I think from my point of view, it's one of the leading organizations in educational and in education and prolotherapy, and in the missionary trips to other countries where we can provide treatment and teach and learn how to do prolotherapy. So, and this organization based on Wisconsin medical school, Wisconsin the university,
Okay.
and they once a year they provide educational seminars. So I went there first. And after that, I signed up for the Honduras mission trip. You cannot just go there. You have to be accepted to go there. And to be accepted, you have to go through the formal education first. It's a very it's a very grounded, fundamental educational organization. I mean, organization which provides education in this field. Plus, it's really it has a very long-standing history of missionary trips of not only prolotherapy, but again, I'm focusing on prolotherapy, musculoskeletal stuff, to Honduras, Mexico. Now we have, and it's international group of doctors, international seminar, an international group of doctors. We have a lot of doctors from Italy, we have from Turkey, we have from Egypt, we have from Argentina, we have from, of course, Canada, always with us. So we have extremely passionate group of doctors, and we go together, and it's amazing. It's amazing trips.
So you're still going on those
trips? Yes, definitely. I love it. And actually in 2020 we're supposed to go to Philippines. It's the first time. We should go the first time, but we couldn't. We canceled because of COVID. And one of the doctors from Italy, he arranged kind of branch from our American group. Now they have European branch of this our organization. They go to Greece and provide free treatment there. I was invited, couldn't have a chance to go, but still hope to one year we'll go. But this how really this sometimes stranger 2 minutes talk can really change our life.
Someone just walking right up to you.
Yes, absolutely, yeah. And we still in a very good relationship. He's a very bright guy, and if you have interesting case, I'll get in touch with him. He's sharing his knowledge, and it's amazing. It's amazing thing to do. It's very rewarding. And again, coming back to regenerative treatment, we can. Again, the prolotherapy fundamental one, and the PRP Pro, it's kind of next level. Now we have stem cell. It's a hot topic.
Yeah, that's what I was going to ask you about, the stem cells.
Yeah, stem cell. Stem cell again. I believe it's still Wild West.
Really?
It's a lot of
so
research.
You don't ever go right to stem cells? Is that ever?
No, I personally don't.
Okay.
Again, I'm not saying the right or wrong. I'm just talking about myself. But what I do love to use, I use exosomes.
Okay.
Exosomes, it's a product of stem cells. So when we inject stem cells, the actual repairing job is done not by stem cells directly. The stem cells have to produce exosomes. Exosome, it's like a bubbles, like tiny. They're much smaller than the cell itself.
Okay.
And those exosomes, they're like a soldiers on the ground. Those exosomes actually doing the repairing work. So when we inject stem cells, we do not know how the cells survive the stress of injection. It's a stressful cell. And we do not know if the body can provide ideal environment for the stem cells to produce this exosome inside the body. Mm-hmm. So technique was developed when they get the stem cell, and we're talking about the stem cells from umbilical cord or in the placenta. So it's very young, with the great potency stem cells. So in a lab, they create perfect environment for these stem cells to produce exosomes, and then they make a product from them. So I use exosomes as injectables to facilitate the to really it's another way to start the regenerative process. And the beauty of exosomes is they also can be used for inflammatory arthritis, like autoimmune condition like rheumatoid arthritis. Because, for example, you cannot, I do not like to use prolotherapy or PRP prolo for autoimmune inflammatory arthritis like rheumatoid arthritis, because this treatment will create inflammation. And the joint is inflamed already, and the immune system overstimulated. So you do not want to create inflammation
more
on top of
inflammation.
Yes.
But you use it for other types of arthritis?
Yes, right? Of course.
Okay.
Of course. Okay. Yeah, no, you can use it for any area which need regeneration.
Talk about for prolo, right?
Yes, again, and you can combine you can do one things after another. Mm-hmm. Again, it's art. You can combine it in a different way. It depends on the situation, the patient preference, and the patient underlying medical conditions. So you have to put everything in consideration and create the protocol for the particular patient. But for why I'm mentioning specifically autoimmune condition like rheumatoid arthritis, because we do not have a lot to offer for this type of patient. Mm-hmm. It's a very unique situation when the immune system is too active and start to attack its own body, the person's body. And we really have to be very thoughtful and very gentle with this type of treatment for these people, because the immune system, again, responding not in traditional way, if you will.
So the exosomes.
Yeah, the exosomes, and we have another product so-called placental matrix. It's an extract from placenta. Again, for example, for people who came from Europe, it's not really new. It's new stuff, but it's not new. For example, when again back to Soviet Union, we used to have ampoules with placental suspension. It just also kind of not exactly extract, it's just the placental product.
Okay.
And we use it to stimulate, again, the healing process in the body. We inject it intramuscular, just intramuscular injection. For example, if person had a very poor healing, stomach ulcer, and we did different treatment and nothing worked, and the ulcer is still there, it's poor, and the poor healing, we did the course of different vitamins injections and placenta suspension injection intramuscularly. It did in the body, it is intramuscular injection. and really stimulate the immune system and the healing potency of the healing ability of the body, and this ulcer will heal.
And that was something that
it
you
was
did in the Soviet Union.
Yes, but here, like 21st century United States of America, much more advanced technology, more purified product. So again, it's kind of new, but like for people who came from Europe or whatever, it's not new idea. It's new level of like quality and technology, but not the new idea.
That's right. I mean, that kind of goes back to what you were saying, that regenerative medicine has been around
for
hundreds of years.
Yes, hundreds of years.
And more now there's just
so again we just the more advanced and more technology and knowledge, of course, deeper, and those times we were like using like intuitively, probably maybe without like too much like scientific data, but observational data, which extremely important from my point of view. But again, the placental matrix, it's extract from placenta, which has a lot of proteins. The placenta itself designed by nature to support life. That's it. So you will get
better than that environment.
Absolutely.
Yeah.
Absolutely.
So that was something done that you had done in the Soviet Union. What differences, I'm sure, because that's a pretty big difference, right? What differences do you see in medicine there and your practice there, and then coming here and practicing medicine?
Well,
I'm sure there's probably very different.
Yeah, yes, it at some degree it is different, and our environment shapes us, and and again, I think I'm privileged to have education in Soviet Union, my medical education, and have my education in U.S. And both systems have like their good things and not so good. And if you know both sides of the like medal, if you will, so you can combine the best from both approaches. And this is what I love to do.
That goes to what we were saying about, taking two things. You kind of the right answer is somewhere in the middle.
Yes,
of the two, right?
Yes, most of the time. So, and like my kind of, it's just my view that like in European approach and like in Soviet Union we have kind of like European type of like education and approach to the treatments. Kind of we mostly like went to from patient to tests, if you will. So because probably, I don't know, we used to have shortage of everything. And medications and diagnostic equipment and like everything. So doctors, first of all, have to rely very heavily on the knowledge, and we had to establish diagnosis at the bedside. We just didn't have any other options. You had to know. And establish the diagnosis and had the basic idea, start the treatment and be creative from what we had when we didn't have a lot.
And that is just what you're seeing from the patient, not
from the patient. Yes, absolutely. Look, even like whatever, like when you have like house call and the patient complaining about the stomach pain, there's the pain in the. And when patient lying down like in the cradle position and afraid to move, so it might be like peptic ulcer, just the ulcer in the stomach. But if patient like with the same like abdominal pain, but abdominal pain and cannot really find the position and like changing the position all the time, right side, left side, and like. Probably something wrong with the pancreatitis. So it's just, even as you're looking at the patient, stomach pain, but the pain in the abdomen, pain in the abdomen. But even how the patient lying down in the bed or lying down or not lying down. So you can have you can guess what is going on. And actually you can like start the treatment or whatever, they send to the hospital if it's necessary. And based on that, you start your you order your tests. Here, because again, I'm not, I believe that the old time in US probably it was the same approach when the technology was not so developed.
Okay.
And doctors
Yeah,
had
that
to
makes
like
sense.
use
Yeah.
their like knowledge, hands, and observation to establish the diagnosis and start the treatment. But now here in US, we're really spoiled. We're lucky. We're lucky. We're very extremely lucky. But at the same time, we're spoiled being lucky with advanced technology. So we have like tests and imaging study at the tip of the finger. In a lot of places, it's not the issue to order any kind of tests. So in kind of my kind of feeling that here we more go like from the test to the patient instead of from the patient to the test, going from the test to the patient. And
Makes sense. I mean, so
and again, on one hand, we're extremely lucky to
yeah,
have
it's a
this.
good thing.
Yes,
Yeah.
it's an absolutely
Yeah.
good thing. But at the same time, I think doctors should not lose the kind of like
lose sight
direct.
of the personal
Yes,
side
a
of the
personal,
patient.
personal connection.
approach.
And again, like for example, the same like the blood test. I mean, it will give us a lot of information, and we of course we have to know what to order. We have to know how to interpret the data. But at the same time, we should not go like blindly with the blood test result. We should not forget about the patient.
Yeah.
And like the brightest example of it, like the vitamin B12, we have a lot of time can be like patient might like based on what patient, how patient eat, what patient eat, any like history of kind of medical condition, any surgery, whatever, and the patient's symptoms might point toward the potential B12 deficiency. But if like blood test showing the normal B12 range, it might be missed.
If you're just
If
looking
if,
at
doc,
the, if you're
if
just
we
looking
really
at the test
focus it
results,
just
yeah.
at the test,
Yeah.
but it might be a situation so-called hidden B12 deficiency, when the B12 is in the blood
Okay.
with a normal range, but for some reason it's in a form which body cannot utilize. And body suffering do not have enough like B12 available for cells
So
to use. So so my point is that we should not really like again, it's extremely good thing to have this technology available.
yeah.
But again, we have to keep our patient in focus. Another like great example, like I remember I read this study when I was in the residency program. They took like group of people with a history of low back pain, and they had the MRI done for this patient, for these people, and the similar group of people were like chosen without the history of low back pain, and the MRIs were done on them. So percentage-wise, amount of herniated discs in both groups were the same. People with the history of back pain and people without the history of back pain. So the point is, yes, the point is that the fact that the person has a herniated disc doesn't mean automatically that this disc is a reason for the patient complaint for the back discomfort, for the pain. So it might be
Because someone could be living with the exact same thing and have
exactly
no pain at all.
Of course. So again, if patient complain pointing to the particular area, the physical exam pointing to the area, and the MRI showing that the herniated disc in this particular area. So if all three pointing toward this particular spot, then probably what we see in the MRI is our cause of the problem. But it's not always the case.
No, it's not.
No, that's why we have a significant amount of patients with so-called failed back surgery. People having surgery for the back problem, and the symptoms didn't go away.
They're still in pain after. That happens very, very often.
Yes, unfortunately. Or patient come with the one of my patients, actually my very, very first prolotherapy patient, she's still my patient, but she sees me just twice a year for like kind of maintenance treatment, not really like, she doesn't need prolotherapy even. She doesn't need it anymore. She came to me like a while ago for the second opinion because she was told that she has like advanced arthritis in her knees, and she does have advanced arthritis in her knees, and she has to have both knees to have a knee replacement surgery. She was a retired nurse. She asked for second opinion. I offered her prolo and viscous supplementation. So we combine again the conventional like viscous supplementation treatment, lubrication, hyaluronic acid injection with the prolotherapy to support the joint. It took us a while, and I'm saying us because again it's
you working.
It's
back
me.
and forth
It's a patient and doctor. I mean, doctor by him or herself cannot do anything. I mean, the patient has to like fully participate in the process. So it took us about like it's a lengthy period of time, but as of now she's practically pain free, and she's like Medicare patient. She's like 80 plus, and she participates in the kind of like the exercise activity for the elderly people. But what I'm saying
That's pretty amazing.
Yeah, it is amazing. But I'm saying that she met a lady in her exercise class who had knee replacement like a while ago, and they were talking, and the lady told my patient that, I am scheduled for another knee replacement while being in an exercise class. So if person is able to do the exercise without really like taking too much pain medications, why do the surgery? And my patient told you, why don't you try like prolotherapy first? Maybe you won't need the surgery. Oh, no, I have bone-on-bone arthritis. I was told I have to have like knee replaced. So again, the treatment of the X-ray, not the person is able to go to the exercise class. We have bone on bone. A lot of people have bone on bone. But when your knee started to hurt today and you had the X-ray which showed bone on bone, your knee didn't hurt you like a month ago, and you didn't do the X-ray months ago. But if you would have this X-ray a month ago, a year ago, you would see the same bone on bone but no symptoms. So the fact of bone on bone doesn't mean automatically that you have to
that's the cause of
cut off your knee.
Yeah, that's right.
But you might need it. Mm-hmm. I mean, if it's like excruciating pain, you tried everything what does exist, nothing worked, and you compromise your quality of life, of course, and we're lucky that we have this option available. But it should be last resort, not the first one when Tylenol didn't work,
Oh, that's right. That makes a lot of sense. I think that creative side probably comes from your experience in having to find out these different, where you didn't have everything like just so easily accessible to you. Maybe.
But again, I always like firmly believe that our body, like in Russia, we have another great expression, like despite doctor's effort, patient survived.
The body can still take care of itself under the right environment.
Heal. We really have to try very hard just to bring it down. But body is recovering, and we have self-regenerative mechanism kicks in. I think in hour or two since we're born, just immediately kicks in immediately, and it's always there. When we're getting old, it's not as effective as it used to be, and it's not like whatever, and we have to support it, but it's still there. It's like a computer program.
Just re-stimulate it.
Exactly. And kind of my belief that as soon as body has like everything what is necessary, and again, and we're talking about the immune system should work properly, and nutrition should be like in the right level, and vitamins and minerals, and again in psychology and in belief.
Do you put people on any specific diet or try to direct them to a specific diet or any like outside tips or things that you would give people who you're going to start prolotherapy with?
Yes, not just the prolotherapy, but when people come the kind of like musculoskeletal issue, I
Yeah.
always ask what they eat, how they eat, and if I think that the issue is with arthritis,
Okay.
particularly arthritis, I always recommend some I recommend some dietary changes to like avoid some food which will maintain the acidity in the body.
Okay.
And for some people, it makes huge difference. Not people respond the same way,
Not everyone responds.
but a lot of people feel significantly better just changing their diet.
So
And
what type of foods might be lower that inflammation, and what foods would you tell people to avoid?
like a lot of people know about these nightshades,
Yeah.
tomatoes, eggplants, white potato, sweet pepper. All of them genetically related.
Mm-hmm.
They're all like all they're like cousins.
Okay.
Yes, and all of them have so-called salonic acid, which is very bad for joints if person has arthritis. If person doesn't have arthritis, that's fine. I mean, it might be bad for the other things, but they also have some nutritional benefits. So it depends on the patient condition. But for now, we're talking about the arthritis. And also dairies.
Dairy.
Yes, dairy. And as soon as people stop eating this stuff, yeah, there be some other things, but this is kind of
Those are some
major.
main things that
the
create.
main
Okay.
thing, like especially tomatoes and eggplants and dairy, like
Wow.
3 things. And a lot of people like doing much better. And at the same time, when for example, I have a patient who is like a situation where under control and everything was fine, kind of, and all of a sudden get worse.
Mm-hmm.
Or, for example, the gouty arthritis, all of a sudden get worse. I'll always ask, what did you eat like day before, 2 days before, 3 days before? And I will start to like mention this food. And most of them, no, I didn't change my diet. No. Did you go out? Did you invite somebody? Did you visit somebody? Did you try something new? And like maybe 90% of the time we're able to identify some food which was
Wow.
eaten and triggered the exacerbation. Like one patient said, oh, you know what? I bought such a great, I didn't eat tomatoes for a year and I love tomatoes. And I was like in a market or whatever in a store and I saw this like, beautiful tomato. I just bought it and just had the salad with tomato. 24 hours later, horrible joint pain. And it just...
Pretty amazing, yeah.
Yeah.
And I'm sure it varies between patients too, because certain foods are gonna, like you said, they're gonna affect people.
Yeah.
differently. Yeah.
And again, that's okay to have it. For example, if you want to enjoy it, so you will have it. You'll pay your price later, but it will be on your term. Well,
At least you know.
Yeah, at
right?
least you know. But
what's
okay, I'll
coming.
enjoy it now. I will deal with it later. That's fine. We're all humans, and again, we have to enjoy our life. And food is a great part of like our enjoyment. And like I mentioned, the gouty arthritis. It's a well-known fact that after Thanksgiving, a lot of people have worsening of their gout arthritis because turkey meat, very bad for gouty arthritis.
Really?
The gout, yes.
What is it? Do you know what it is?
No, because
Turkey?
it's the people who have a gout arthritis. The body cannot process properly red meat in turkey as well,
Okay.
and the like when our body digests the like red meat and
Yes.
so the one of the like intermittent product of the digestion it's uric acid.
So-
It should go further to be degraded to other substances. But when body cannot, people have a gouty arthritis, the body has a problem to go further to break down the uric acid. And uric acid, it's like it's a crystal, like a salt crystal. They're like sharp. And they really like physically get into the joint and
They're
it
just
causing
damaging.
the inflammation.
Wow.
Yeah. And like friend of mine just called me and asked, look, my husband was like with all this diet, and she's extremely strict about the diet, purification, all this stuff. And she called me one evening, said, look, all of a sudden, my husband has his like gouty arthritis, which he didn't have for a long time, and ask you, what did you guys eat? Nothing, less always. And I start to ask the question this and that, and ask about turkey. She said, no turkey. I said, oh, wait. I think like a week ago we bought turkey sausages.
Wow.
He said, oh I forgot about it. Yes, and they ate it and they loved it, and like a week later he's like that. So it's extremely important what we eat, and we can like influence our body both ways.
Mm-hmm.
We can make it worse, we can make it better, and we cannot. We can cheat ourselves, our mind, but we cannot cheat with the body. Body will know.
Yeah.
It's
it's interesting because I don't think many doctors treating musculoskeletal, I don't think they take that full holistic approach. I think that's I think that's a rare occurrence. I don't see that too often.
I don't know, but again, I'm extremely happy with.
But it makes sense. It makes sense that
yes.
would be that. It makes complete sense that that's going to affect everything.
No, of
right?
course.
So why wouldn't more people take that approach?
It takes time.
Yeah.
And unfortunately, again, we cannot like blame doctors for everything.
No.
No. Look, again, doctors are human beings too. Yeah. Nobody's perfect. And things happen. But at the same time, unfortunately, the way the medicine goes now in the system forcing doctors to be very quick, and we have to patient in, patient out, and especially work in big places and whatever circumstances.
There's a lot of pressure to.
It's a lot of pressure. It's a lot of pressure. Yes, and just to sit down and ask patient, "What do you eat, honey?" I mean, you have to have a time for that. You have to have a time, and unfortunately, the system really not favoring this type of approach.
Because if you need to see a patient in 15 minutes or 30 minutes, then you're going to produce a structure to that appointment, and it's going to be like a nice exact same structure for every single patient.
Yeah.
And then you're not going to get those questions like you're saying, where it's if everyone is unique and everyone reacts differently to different foods, then you won't get that if you just have the same structure.
Absolutely. And when you have patient and a relatively young patient complaining about the tingling in his feet or kind of cramps or whatever, and there is no history of diabetes and this and that, and I was seeing neurology, the test was done, I was told that I have neuropathy and nobody knows why, and ask what do you eat? I'm vegan for many years, so I do not eat animal protein. Do you have any supplements with vitamins? Again, here we go again. Do you take vitamin B12? No. So probably it might be related to B12, any other things, whatever, just example, which is in the surface. But the point is you have to have a time to talk,
to figure that
to
out.
To ask the question. And question takes time. That's why detailed history and not only physical, but detailed history.
Mm-hmm.
It's extremely important. And
it is.
I don't remember who, I think one of the kind of old doctor, so maybe 19th century doctor, saying that when patient come to the doctor, actually patient will tell doctor exactly what's wrong with him or her. The doctor's job is just to put the label name on the situation, on the condition, because patient will describe all symptoms. And
so it's already laid out for the doctor.
Yes, absolutely. The doctor just have to see that they have to put everything together and just put a name for it. this is a job, doctor's job, it's actually just to name the thing. But patient will tell you everything if you will listen, if you will ask the right questions. But again, you have to have a time for that.
Yes.
And a lot of doctors pushed against the corner, and just would love to, but cannot. So it's not just doctor's fault.
No, I don't think that at all.
No.
Hopefully,
and a lot of doctors are depressed about it, so they're not.
There's like a guilt kind of like.
Absolutely. And
time.
it's not the healthy situation, not for the doctor and not for the patient.
Mm-hmm. Well, hopefully, these types of approaches can kind of grow and.
I have a feeling that the kind of, like demand and supply.
Yeah.
The same thing in medicine or any other industry.
Mm-hmm.
So I have a feeling the kind of people slowly waking up, in this type of regenerative approach, holistic approach, kind of getting the momentum and become more and more known.
Mm.
And again, in Russia, we're saying that the savior of the drowning person is in the hands of the drowning person. So we really have to save ourselves. Yeah, and when patients become their own advocate and asking the right question and looking for the right doctor, whatever. And this, I hope that again people waking up.
Yes.
And they do not want to be. They want to be seen and heard. And this probably hopefully will bring doctors back, will give doctors better chance to come back to their patients.
Mm-hmm.
I hope so.
I think so.
Yes.
I think so. It seems that way.
So.
It seemed like there was kind of that awakening. I
yes.
believe that.
Yeah.
How do you see your practice now? Where do you see it going? And I guess what type of new treatments are you looking into, or how do you see it adapting? I know that was a few questions there, but where do you see your practice? I guess the whole thing is, where do you see your practice going?
Well, again, I provide on one hand conventional type of treatments if patient prefer. I mean, I absolutely respect my patients' kind of wish, and they have their rights to choose. But again, I'm doing my best to provide it at the best level possible, based on my knowledge and training and expertise. But at the same time, kind of really my heart belongs to regenerative treatments, and it's it's an endless process. It's like an ocean, and always trying. I mean, again, I'm focusing a lot on regenerative treatments, and I'm learning new technique, new approach. I do a lot of I love my ultrasound. I do a lot of ultrasound guided injections. I do which really increase the precision of the procedure, makes it safer, more effective, less discomforting. So I continue to learn my ultrasound. I continue to learn about this. So the point is where I see myself and my practice. So to continue to develop the regenerative treatments and improve techniques, and then find probably more interesting combination, more effective combinations, and also nutrition, extremely important. I pay more and more attention to like my father taught me when I was in elementary school. He even drew the diagram. The more you know, the more you don't know.
You keep going down that rabbit hole.
Yes, absolutely, and it's so true. Any new conference, with after each and every conference, I'm coming back with a new idea. Oh, I have to learn this too. Or the next time I have to go to another conference. So the more you dive in, the more question you have. Actually, you get answers for the particular situation, the questions. But on top of these couple answers, you have 10 questions. And the more you look for the answer, the more question. You do get your answers, not all the time, but most of the time, maybe sometimes.
So I see you I see you going into the future, just adapting as regenerative medicine adapts, and you.
And the science,
and
of
your
course,
own
of
practice.
course, in science and technology, it's unbelievable, and we're so lucky, we're so blessed to have this. And I believe that kind of like Dr. job is to like combine the wisdom of generation before us with the great technology what the modern age can offer.
So don't let go of the past. Like,
Yes,
don't let go
although
of
the
those
past,
roots,
yes,
but,
yes,
just use it with the new technology.
with the new technology, and this I believe it's standard of medicine should be, and eventually, hopefully, will be. Who knows?
Yeah, I like that. Those are some wise words. I think there's a positive future ahead.
Yeah, absolutely. We have to. I mean, of course, we have to be positive, and we have a lot of things to be thankful for, and a lot of things to like. It's not just let's be positive. So we objectively we have a lot of positive things happening in our life, but it's up to us what we'll focus on. And
I think that's a good place to leave it.
yeah,
It's pretty on a nice positive note.
yes, absolutely.
Thanks again for coming on.
Okay, thanks for doing that.
Absolutely.